Before anything, I want to present Styledent. Styledent is a lab that has been in existence since 1993. My dad started Styledent here in Canada in 1993. And after 50 years of working, he retired. Of course, before that, in 2009, I joined the team, which the team was him and one other person, and then me. And in 2009, me and Lydia got together. Lydia quit her job in marketing and joined us, and helped get this business to the next level, to where now well, great timing, but we just opened in Florida, so we'll see how that goes. But so far so good, knock on wood. But it is what it is, I guess, for everybody at this point. But we are very grateful, very thankful. We have an amazing team. We love our team to death. I mean, we have amazing people working for us. They have been there for us in hard times and good times, and we also hope to do the same for them. So before starting the actual conference, I would like to share a little video that shows our team, shows who Styledent is, because let's face it, all of the results that we get, the beautiful restorations that we make, the long-lasting restorations would not be possible without this amazing, talented team that we have. So we're not a huge lab. We're about 8 to 10 people, depending on the seasons, depending on who's on mat leave or not. But we remain a very, very high-end, high-quality dental lab. One of our biggest niches are single centrals, full arch cases on implants, complicated, mostly complicated cases. Of course, we do also the regular, single unit crowns, but we're pretty busy with bigger prosthetic kind of cases. So let me just start with a little 1-minute video. So there's a little video presenting who we are and what we do. I hope you guys enjoyed it. So let's get to the subject. I've always believed in one thing, and whether it's for, using CAD/CAM as a tool, technology in CAD/CAM, technology in injecting porcelain, technology in materials, there's also technology in tooth and shade taking. There is one thing I've always believed, which is, in order to give a great result, we always have to mix analog and digital together. So there's no way that we can do amazing and bring amazing results by doing things purely digitally, nor the other way. I think you can get beautiful results doing them in an analog fashion, of course, but nowadays it's very, very difficult to do unless you're one technician, one-man lab, because it's just not an efficient workflow, and it just, is not going to allow for consistent results. So as true as this is for CAD/CAM, it is for shade taking. And the way we use basically analog technology and digital technology is by using eLAB. We've been using eLAB for about 2 years now. This is not a new thing that we're trying out. So it's good that we have the experience, because especially with what we're living, the situation we're living in today. Shade taking is going to be a little complicated, and also if we can avoid it, why not? And this will allow us to avoid having patients coming in and feeling uncomfortable and going to another place yet again to have their shade taken. Everything can be done at the clinic, which is awesome. So the analog part of that is, of course, I will show you in the slides, is the layering techniques that we use, the porcelains, the recipes that we make, or the recipes that are suggested by the actual software. I'm going to talk about all those things, but mostly, you know, the fact that it's our hand that will create that shape, that will create that color with porcelain for that final restoration. So before beginning with eLAB, let's just talk about color in general. It's very important to understand this because part of this is how eLAB works, and it's important to scientifically understand how it works, just to, you know, to understand why it does work. So if we take basics and we take color, color is comprised of three things. So we have value, we have hue, and we have chroma. When we're talking about value, we're talking about the white or black. So if we say something is very, very high value, we're talking about, for example, a bleach shade, as opposed to an A4 or a 5M3, which is very, very low value. So that's what it is. It's basically going from black to white, as we can see over here. Then we have the hue, okay? And the hue itself is an actual, I wouldn't like to use the word color, but it is part of, like, is it in the oranges, in the yellows, and the blues, and the purples? So that is the hue, basically. In what hue does it fall on? And then the chroma is the intensity of that hue. So here we have an example, for example, if we chose green as the hue, and then we have the chroma, there's an intensity of 0 to 10. The more intense, obviously, has more pigments of color in it and gives you that more intense green, where you can have less pigments and have a lighter green. So that is what chroma is. So if we look at a tooth, a natural tooth, there is different factors that determine tooth shade. So we have dentin, we have enamel, and those two have certain variations within them. So if we look at dentin itself, that is what's responsible really for the chroma, and this is what affects really the saturation and the luminosity of the tooth, so the value of the tooth. And value is one of the most important things. I mean, if you can have a tooth that doesn't necessarily match 100% in color, but in value, if it does, it's going to pass, because it's really value. Value is one of the first things that we can determine with our eyes. And eLAB, part of a lot of what eLAB does is work on the value, which is amazing. The enamel, of course, is a little bit more complicated when it comes to shade taking, because it has translucencies, it has transparencies, and it also has opalescence. So many times, I mean, you know, we get shade instructions, and we see that you know, we ask for like a bluish incisal, or something more gray, or just something more, you know, mostly bluish more than gray, actually. That's opalescence. So we know that when we see blue, that means opalescence. So we go ahead and add opalescent materials in that area. Transparency and translucency, it's important to know the two different things. What is translucent is not transparent. Transparent will tend to go towards gray, because that's basically like a window where light just goes through. So the more light goes through, the more it's going to gray. And translucency is not going to allow necessarily all of the light to go through. It's going to penetrate the light, and it will be absorbed also by the tooth. So it's like a sandblasted, basically, window. So that is what translucency is. And then we have opalescence, of course. So opalescence depends on refracted or on reflected light. And it does tend to change in color depending on the particle size. So we have bluish, we have orangey, we have milky white for very big particles. And then, you know, bluish and orangey will depend on how the light hits it. Is it refracted? Is it reflected? So that's basically the main things that we need to look at when trying to determine tooth shade as far as color. Now, there's other elements that are very, very important, and that, believe it or not, do influence color. So surface texture, you would never think that the actual surface texture of a tooth influences the actual color, but it does influence the perception. It influences how we look at things. So, I mean, let's face it, natural younger looking teeth that still have a lot of surface texture will reflect light much differently than older patients whose enamel has, smoothened down and has become much more smooth on the buccal surface due to obviously the age. That will definitely reflect light much different. So this is an important fact not to forget, is to take surface texture and look at that and try and visualize it as much as we can. And then we have color characteristics such as fluorosis, colored foci, if we're talking about posterior teeth. Yes, we do have clients that do send us, patients for molars, or, that's what we do. So, I mean, we have stains, we have white spots. It's important to look at those things and also to determine, are they internal or are they external? So if you have an internal characteristic and you're putting it on the outside, it's not going to look as natural, and vice versa. So each thing has to be put and placed in the right manner, I guess. So we obviously have different ways of taking shades. We have the classic shade guide, which is less and less used because, I mean, it was invented in the 50s, 60s, I guess. It was a long time ago. And then in the 90s, we, Vita came out with their 3D Master Shade Guide, which also has been modified to this box here that you see on the right, which is very easy because it's really a step-by-step guide. So you start with value, you choose the value, and then you go on. Once you choose the right value, then you'll have the next option, and it's just much easier to, basically screen the colors and get to the right color. So the Vita 3D Master, the difference between this one and the classic 3D or, Ivoclar shades or whatever other shade guides that you guys have and use or we use, was the first shade guide really to use all the 3 dimensions of color that I was talking about earlier. So hue, value, and chroma. So we have the first number. So when we're looking at this, for example, we have 1 and 2, right? The first number, the 1, is the luminosity, the value. The letter is the hue itself. And then the other number is the saturation. So it's how intense is that hue. So if we look at it over here a little bit more in detail, we have 0 and 5. So for example, 0 M1 and then 5 M3 is the other extreme, right? So this is the value, right? We have the higher luminosity, which is towards the 0, and the lowest towards the 5. So low value, high value. We have hue, so we have LMR. This is why we have, for example, 2R 1.5s and 3 M3s and 4L, whatever, 4L 1 point, whatever. You get the point. The point is that we have the M, which is basically the chromatic tone, right? So we have the M for the middle, the L is for less reddish, and the R is for more reddish. The second number is the saturation, so it's the quantity of pigments per basically group. So this is how we can explain the 3D names, why they call them 2M1 or 2M2 or 2M3. So when we're taking shade, and this is basically how we do it at the lab, and if you still want to do it this way, that's fine. Let's just go ahead and share some tricks over here. In this case, we can, I mean, we're lucky enough to have the space to put the shade guide there. So we can just place it right next to the tooth, and that is honestly the nicest and easiest way the most accurate way to actually take the shade, because we have one tooth that we want to copy right next to the shade guide that we believe the color is right. Of course, we cannot do this if it's not an implant restoration and a dentalist one, like this case over here. So that's pretty much, not necessarily our norm. If that's the case, then we can go ahead and do it this way. So we're using the middle of the tooth of the shade guide. Like this, we can see a little bit the incisal edge, and we can also see the gingival third. And then when we're having a gum shade to be taken, for example, in this case, we will have to add some gum. What we do is we give our clients, we order the actual porcelain, the pink porcelain kit that we have. So they have shade tabs specific. So what these are literally baked porcelain that will, in different thicknesses, that will really indicate the actual powder of porcelain that we're baking in our oven and the actual outcome that it comes out to look like. and we provide the shade kit like this, we can actually see what color goes where in a gum, because making a porcelain looking gum that looks natural is very, very challenging. And it's not just one color. For those who say, you know, I don't like pink because it looks like bubble gum, well, it's because it wasn't necessarily done properly. You have about a minimum 3-4 colors to play with for proper gum reproduction. So then once you take all these colors, you want to make a little simple drawing of a tooth. And just, you know, note, we have surface texture over here. So if it's, you know, you can make a little scale between 1 and 5 if there's a lot of surface texture, if there isn't. So how is it? Is in middle. So 3, that will give us an idea, or just write young or older patient. And also, of course, make sure that the actual impression taken, whether it's digital or analog, that the adjacent teeth don't have any pulls or drags on them, so that we can see, especially for aesthetic cases, we can actually see the surface on a plaster model. That is really one of the best ways to look at it. And yes, it's possible today with 3D printing as well, but not as well as a plaster model, because I mean, 3D printing, even the most precise printer, you will see little lines where on the plaster you're not going to see them. And then you just want to add certain effects. If you're doing this at the operatory, you want to add if there's a little bit of grayish or a little bit of bluish or whatever effect that you do see. And if there's gum that is going to be required, of course, add the color of the gums. And also the pictures are what are going to be necessary, of course. So if you take these pictures, take them this way, and on top of that, add the little schema. It helps us look at both things together. And of course, one thing that is good to mention is make sure that we can see the actual shade guide number and color. Like here in the second picture, that's not necessarily correct as far as the shade, because we have no idea what shade guide that is. So this is why it's important within the picture to make sure that you can visualize and see the actual number and name of the shade guide, whether it's for gingiva or for just the tooth shade. Other suggestions, of course, here very often we do see this picture here, which is the X. So that is very wrong, because the actual shade guide and the tooth are not on the same plane. So it's very, very important, especially when using eLAB, the positioning of the shade tab or the gray card. We're going to look at that a little bit later on. It's very important that the positioning of the shade tab and the natural tooth that we want to copy are on the same exact plane. So here, I mean, this is completely off, because I mean, this is going to completely affect the outcome, just because the light will bounce differently on the shade tabs and it will bounce much differently on the natural teeth, because they're just not on the same plane. So we really can't see reality like this. It gives us an idea, but it's not going to be a precise idea. So what we want to do is this over here, the first picture. You see how the shade tab is exactly on the same plane as the actual tooth that we want to copy. And then if you want to go a little bit more into detail, you can go ahead and if we're talking about a posterior tooth, just make a little drawing like this one, and just, you know, explain what you see on the occlusal surface, because it's not necessarily very easy to take a picture of the occlusal surface. So just a little drawing, just tell us if there's white cusps, or if there are very, very dark. How dark are the fossa, etc. Some people don't like, a lot of people say don't darken the fossa, but a lot of cases we've seen that people just go ahead and put the brown everywhere, and that's why it looks odd, and then people get tired of that and they don't want it. But we always add a little. It's just the way you add it. We add fine little points just to play with optical illusions, contrast, and give that perception of depth. So that's the whole idea, and it won't look dark. So it's all in the way of making it, and the only way to make it is by having all of this information available to us. So if we look at these certain factors that do influence color, of course, it's not just the mouth. There are many other external factors that do influence color. So let's talk about lighting. So in general, we do want to, a lot of people believe that natural light outside is the best color for, and the best lighting for shade taking, which is completely wrong. It's not. It's the worst thing you can do. because it's very variable. So we have a cloudy sky, we have a sunny day. What time of the day are we taking that shade? Are windows tinted? Are they not tinted? Is the sun directly on it? Is it not? All of these are factors that do influence the actual lighting and can falsify the results. So the ideal shade taking color is middle of the day, few clouds in the sky, mostly sunny, and basically this, if we look at it into Kelvin, which is the temperature heat, it's 6,500 kelvins is what we need, which is very, very impossible to predict and to plan every time you have a shade taking. You know, you can't unless I don't know, you have a special bond with whoever it is that you know, regulates our temperature out there and has a sunny or cloudy skies. It's pretty much impossible to do in a consistent manner. So daylight cannot be constant because it really does play between 2000 and 27,000 Kelvin. So artificial lighting is what we strongly recommend. So if we look at this little scale over here, if we take a candle, for example, which is around 1500 Kelvin to 2000, that's very orangey, so that is definitely not the right light. Then we have the sunrise and the sunset, which are around 3000 Kelvin. And I mean, you guys can determine that with your own eyes. You see how beautiful a sunrise is and a sunset, and it is very orangey. So taking a shade when it's a little more towards an orangey color will obviously affect the lighting. And then in the morning, we have about 4000, which is more yellowish. Lunchtime now is starting to become more ideal because we're closer to the 6000 kelvins. So lunchtime with sunshine, we're about 6500 Kelvin, which is what we want. And then when it's cloudy, it's the opposite, because, you know, we have the expression of saying that it's a gray day. Well, it's a gray day because it is gray. When it's cloudy, it becomes a little gray or bluish. So we're at 8000 Kelvin, which is not, again, ideal. So the way we want to do this is we want to have operatory lighting that is controlled. So incandescent lighting, for example, again, which is around 2800 to 4500, gives a reddish or orangey color. It's around here, which is not ideal. With the ideal lighting is really fluorescent, and not just any fluorescent. There are certain neons that are specifically for color. So there are between 5500 and 6500 Kelvin of temperature. The lux is about 1200 to 1600. So that doesn't just blow your eyes away when you're looking at the color. It's the strength of the light. The dental light that you have overhead in the operatory must be off, because that can emit up to 8000 lux. So, I mean, you're just going to see white spots everywhere. Your eyes will not be able to determine color at that point. So you don't want to look at that. You want to switch that off, neutralize your eyes before, and then be able to take the shade if you're doing it in the traditional manner. And do not use the dental light, please, to take the shade. A lot of people do that. I mean, it could maybe pass for molar in realistic, you know, in the realistic way of doing things, but not for a single central. Absolutely not. There's another factor, which is the color rendering index. So the coloring rendering index is basically the ability for a light to see colors. So here we have this chart. At 100, we can see all of the colors very clearly. And then the more we go down, you see they're becoming a little more faded, and not necessarily, you know, the differences between each other are not huge. So that plays a big, big part, because we do want a CRI. In French, it's IRC. So it's superior to 90 is what we do need. And they do cost quite a bit of money. I mean, they're no longer $20 fluorescent bulbs. At the lab, we have a company called Standard. They're actually Canadian. We bought them from Interluminaire, I believe. And they have a CRI of 95. So, I mean, that's not even just for our shade taking room. That's also for our porcelain room, just to make sure also while we're making teeth that we can see the real colors. So it's very important to you know, take this into consideration. The regular fluorescent light bulbs at Renault Depot or Home Depot don't really reflect a correct IRC. I believe they're between 70 and 80 CRI, so that is pretty low for the correct color. There is also other makes, like Vita makes one called Vita Light, and Gamin is another make. So, I mean, these vary between 0 to 100. The closest for the correct lighting are these makes, and just basically find out what the CRI is. The environment. So if we look at this picture over here, this is exactly the same tooth, exactly the same color. It's just been outlined by different colored squares. So you can see how the actual tooth takes in that color, and there's no filter on top. It really is just around it over here. So you see how this tooth looks a little more pinkish because it's surrounded by pink, yellowish, bluish, and the neutral remains unaffected. So basically what I'm trying to say here is that when you're taking the shade in the room that you're taking the shade, I mean, I know today they have beautiful fancy chairs that look reddish or orangey or yellow, which is great. I mean, the operatory rooms look awesome, but you just be careful that they're not necessarily, get your patient up, maybe go against a wall that is gray or a neutral colored one. Just make sure that there's no external factors that can influence color, because as you can see here, this proves that it does affect. If the patient has a very colorful clothes, make sure that you can cover them before they with something gray, obviously, or white or neutral colored, before taking the shade or taking a picture or whatever it is that you want to do for the shade selection. And also make sure that the patient is parallel to you and their head is up against the headrest properly. Just because if you're looking at a shade from being under it or being over it is not the same perception either. So you want to have the same level. And for women that have lipstick or, whoever has lipstick, make sure that that is taken off. Often when we were doing shade takings, we would mention this to our clients before coming: don't wear lipstick, or if you do wear lipstick, because some people can't do without lipstick, just be the bad guy or woman that will ask them to please take it off. So definitely lipstick is a no-no. So when do we take the shade? We must take it in the beginning, before we start any treatments, before we start prepping teeth. It's very important. Very often, the number one mistake we see is teeth are dehydrated in pictures. Why? Because, okay, let's prep, let's do the temp, let's do all that. The patient has been with an open mouth for an hour, and then, okay, let's take the shade. That's wrong, because dehydrated teeth, the value goes up, and it does not represent at all the reality. Very, very different. If we take that color to make the final restoration, guaranteed 110% that it's not going to match. Another mistake that we see is shade taking after whitening treatment. So make sure that the whitening treatment has been stabilized about 2 to 3 weeks after the last appointment. A lot of patients are very, very much in a hurry. They finish their whitening treatments, and they want to go ahead and take their shade taking appointments very quickly, basically maybe 2-3 days after they finish their whitening. But it doesn't make sense, because it will just continue to whiten. The color has not stabilized, and we cannot predict that while doing porcelain. So the color we see on that day is the color we would take, and then the teeth will continue to gradually change in color, but the crown will be made, and then it's impossible to basically go back. I'm going to take a little break and ask you guys if you have any questions so far.
There are no questions for now, but don't be shy.
Okay, so let's continue. So let's talk about eLAB now. What is eLAB and how does it work? So eLAB is based on a CIE system. So the CIE system is it's basically located in Austria. Okay, it was established in 1976, and what it allows us is to put color in a 3-dimensional space, which is portrayed by this sphere over here. CIE is basically the International Commission of Illumination. CIE is in French, so it's Commission Internationale de l'Éclairage, and it's composed of 3 coordinates. It's the L, where this is from where eLAB gets its name. It's LAB. So L being determining the luminosity, so black, white of value, basically. So black, white. A is the color nuance between green and red. So over here on this axis over here, horizontal, we have A minus, which is more towards greenish, and A plus, which is more towards the reddish. And then the B, which will play between blue and yellow. So B minus, we're more towards the blues, and B plus, we're more towards the yellows. So this is amazing because now for the first time, color is no longer subjective. So we actually can look at color in a scientific manner. So either it is that color or it's not that color. It's not how your eye sees it. It's nothing of that sort. It really is a scientific way of looking at color. And the way they do that is they would take two different, and this is how eLAB works, is it will take two different shades. It will compare the values of LAB on the one shade and LAB on the other shade. And then with using a Pythagoras theorem, of course I'm Greek, I have to mention Pythagoras theorem and deltas because all that is Greek and I'm a proud Greek. But basically what it does is it can see the difference between those two, which is called the delta E. And depending on that difference, we know if it matches or not. So for example, the average of the LAB of shade 1 and shade 2, the difference, if that difference, which is the delta E, is 1 or under, then that means that we're very okay, because up to 1, a human eye cannot determine the difference. So if the delta E given is 1 and under, we're in a great situation. Between 1 and 3 is not necessarily that bad. It could pass. It can only really be perceived. I mean, at 1.5, it's not too bad. At 2, okay, we're starting to get a color that is off, a difference that is important enough for the color not to be correct. But between 2 and 3, really, a trained eye will be able to see the color. So either a dentist, a technician, or a painter, or somebody in the arts would be able to determine that. And then superior to 3.3, then that can be perceived by anybody. So this is a nice basis of how eLAB works, because I will explain a little later on, but when we're doing our comparisons between our restorations and the natural teeth, this is what we base ourselves on. We look at the delta when possible, and you'll understand why when possible. We look at the delta and we see, is our restoration between 0 and 1, then we're in an excellent shape. For sure it's gonna match. Are we between 1 and 3? Depends how close to 3 and how close to 1 we are to accept basically to say that the case is acceptable, because at 2 it's not acceptable. It will be perceived by a trained eye, and then superior obviously to 3 we're way off, we have to redo it. So this is the main part of how eLAB works. So eLAB was invented by an amazing dental technician who has now become a scientist, Sascha Hein. So Sascha Hein is a guy that revolutionized shade taking for us in this by inventing eLAB. He basically made our dreams come true, and our dream was to have the patient with us all the time. And this is the only way to do it without them physically being there, through pictures. So what it does is it really simplifies shade taking. It eliminates the need for having actual shade guides, because if you have the full system, all you need is the polar eyes, which is a polarized filter that fits on the camera, and the gray card that I will explain a little later on. You don't even need shade guides because the actual software will give us a recipe. And then, of course, that ensures that we get a higher success rate because we can do virtual try-ins. But also the amazing part here is that distance is no longer an issue. I mean, we can have clients that we do have clients, we've done cases, Florida, Montreal, two centrals or single centrals, and we've matched spot on without seeing the patient. But of course, there is a way to do it. You need to, you can't cut corners, you need to take proper pictures, you need to be obviously, have the right settings, all the things that we're gonna look at. So digital cameras. Digital cameras are not that expensive anymore. They're much easier to they're much more affordable, easier to get. And to be honest with you, we've bought our cameras even used. At the lab, we have 3 cameras. We have 2 Nikons and 1 Canon. And I mean, the 7100 Nikon is a great camera. It's gone down in price because it's a little bit of an older model, but it's more than enough what is needed for eLAB. That's really the cameras that we have. So they're much easier to use too than they used to be. So that's not a problem for those who don't necessarily like technology. What you need is also a macro flash. So either a ring flash, which is just a little ring that goes on top of the lens, or the twin flashes. So we have both. To be honest with you, I don't remember what the difference between the two is. I would ask our head ceramist, Sherin, to intervene and tell me what the difference between the, how is the macro flash that's a ring flash better than the twin flash or vice versa. Sherin, do you mind
Yes,
explaining?
sure. Actually, both of them are recommended for the eLAB photos, because we will see later how with with the filter with the filter that we will use, we will eliminate the reflection of the light. Actually, avec the circle one, avec the round one, we will have much texture in the tooth, and less, we will see less the color. And with the twin flashes, we will see nicer all the effect and the color in deep, and we will not see the texture of the tooth. So for the color, it's perfect, the twin. That's why we recommend the twin flash better than the round one. But the round one is working very good also.
Thank you, Sherin. Yeah, we actually have, our Canon has the just the ring flash, and then the two Nikons, we have the twin flashes. So basically, at this point, we want to see color, texture. We can always see it, of course, part of it on the picture, but mostly on the model, we can always see texture as well. So, you know, that's why we mostly use our twin flashes. Now, the beauty of these flashes is that, remember I was talking about CRI and the way that the light can determine and see color. So flashes are 100% CRI. So you don't necessarily need to go ahead and you know, invest a crazy amount of money to change all of your light bulbs in the office. You can just get a flash like this that will cost less, trust me. And it will basically bypass any external influences, because it's very, very strong. You're at a macro distance, and you're getting the right color rendering index. And you're getting the right color temperature of between 6,000 and 6,500 Kelvin. And the third thing you will need will be a macro lens. So there are different macro lenses. I mean, if you look at Nikon, they have between 85 and 105. We have the 85 on one camera, the 105 on the other. The differences are really more towards weight. The 85 is a smaller the smaller lens. And at 85, it's just much lighter, so it makes it easier to take pictures. And then if you look at Canon, I believe it's the 100 millimeter lens. So they're just very different between Canon and Nikon, but in the end, it's very, very similar. Both are perfectly fine. So the other thing you will need for now the full eLAB workflow is the polar eyes. So what this is as Sherin was explaining, is the polarizing filter. So what we need, what we do with this is, this goes over the flash and the lens, and it eliminates all reflections. So this allows us to even see the internal structure of the tooth, because there's no light bouncing back and forth, and that can falsify what we see. And the fifth and most important thing is the gray card. So the gray card is a card that Sasha Hein has called with his eLAB system the white balance. It's a white balance gray card reference. And this is what we use to calibrate the picture taken at the operatory and the picture taken at the lab of the restoration. And in order to put the two together and make sure that the environment and that picture is exactly the same and calibrated. So the way to take the picture is the most important thing. I mean, if the picture is not taken properly, you can have the polar eyes, you can have the gray card, you can, you know, have the right settings, the right camera. If the angulation is not correct, then we're going to be off. The shade is not going to be correct. So the thing to really remember is you want to be parallel to the plane. So what I mean is the tooth itself, the buccal surface, the plane that we're taking the picture of, and the actual lens need to be parallel. Okay, so this line over here and this line over here are parallel. You cannot take a picture like this, for example, where you have an angulation, nor like this, So you want to avoid angulations. You want to be in the same plane. The camera and the tooth and the gray card needs to be exactly on the same plane. Another thing, unfortunately, in the beginnings, about 2 years ago when we first started, we were excited to use this, and some, clients that were new at it, and it's very normal. We start something, we're not until we get used to it, we make mistakes, and that's how we learn. Beautiful pictures, but they were taken in a JPEG. So JPEG, there's absolutely no way we can use a JPEG. All pictures must be taken in a RAW format. So in your camera settings, there is a setting of picture quality. You want to go ahead and change that to the RAW format. Just keep it. I mean, if you're using eLAB, just put it once, don't play with it. Keep it there, because you don't want to have a case where you forgot, because it's literally useless. We get a JPEG, we cannot import it into the software, and there's nothing we can do. Another important thing, as I was talking about earlier, was humidifying the teeth and dehydration. You have to ask the patient to, pass their tongue in front of their teeth, make sure that their teeth are hydrated or rehydrated. Teeth lose their hydration very, very quickly. Pictures must be taken within the first seconds in reality. If not, it's not realistic. At least let's try and keep it under a minute. Hydrated teeth, very, very important. And again, as I was saying, the gray card must be positioned in the same plane as the teeth. Certain settings that you guys can take is ISO. We keep it at 100. Don't use auto. Just keep it at 100. Aperture. So we're talking about f22. So the f-stop needs to be at about 22. Sometimes 20 works, 21, 22. Kind of trial and error depending on the cameras. We have it at 22. Shutter speed 1 to 125. So keep that. That's the speed in which the shutter opens and closes. So you want to have it at 125. The flash 1 to 1. And distance between the lens and the subject, very, very important, between 22 and 25 centimeters. So the way that Shirin does it, she gave me this trick, which I find is a great trick. Take your hand, okay? And it's about, I guess, in general, between 20 and 25 centimeters. And just, place the hand in front of the patient. And you can put the camera at the end of the lens on your palm here in the beginning. So that will give you that distance. So measure your hand, see what the difference is, and use that as a gauge. And that's a great little trick in order to always have that specific distance. So this is really the page that needs to be remembered, because if this is off, then the result will be off. The way it works, the pictures that we need are one picture of, you see the gray card is again on the same plane as the camera lens. It's right below the teeth, and it's taken with a filter. So you see how there's practically no reflections here. We can even see the internal structure much, much clearer because of the lack of reflections. And then one other picture without the filter. So, and again, with the gray card. So in both pictures, one with and without the filter, we do need to have the gray card. Of course, another important, very important picture that we can take with the gray card is a picture of the, and with the filter, is a picture of the prep shade, especially if we're doing veneers. Or if we're matching a single central, no matter the color. I mean, Shirin wrote this in French and I translated it, but she wrote if prep shade differs from the final shade that we want, but make it a rule, just take a picture of the prep shade. It doesn't take much time. And honestly, the more information, the better. And just however slightly different as it is, or even if it's the same, just take a picture of the prep shade. We always need the picture of a prep shade for aesthetic cases. It really is a must. So these are the pictures we need. One with a filter, one without the filter, one of the prep shade with the gray card. And of course, until you get used to it, don't just take one picture, take about 5 or 6 pictures of each, just to make sure that, the angulation is correct and that there are no mistakes, because with one picture, if it's off, then we can't do much either. So while the patient is there, just take multiple pictures of each, and we will only use one of each, the one that is of best, that came out the best. So the way we do it is we import the raw file. Again, don't forget that the raw file is what we need to do. We import that raw file, and we can calibrate that picture that was taken at the cabinet, at the operatory. We calibrate it with a gray card in the software. So this way, what it does is with the gray card, it can measure those values I was talking about earlier, the eLAB values, and it can make sure that it can calibrate that whole picture and make sure that the grays being exactly the same, all of the rest of the picture will be calibrated accordingly. Like this, we have exactly the same colored picture. And now from these three coordinates, we can define the final tooth color and even go as far as getting an actual recipe of the tooth to be made. So here, I don't know if you can see it, but here we selected, for example, Emax Ceram. We use two ceramics at our lab. We have Emax and we have Creation. I mean, in a drop down, there are many, many other companies that they have, and they're adding them as the time goes by. They have Noritaki, they have GC, they have different types of porcelain systems in which they have broken down into LAB values for each powder. And like this, it actually gives a reference. So it says here, you can choose a region, you can make it bigger or smaller to see how specific you want, but you really want an average when you're coming to determining the dentin. So here it will actually look at the LAB values and it will give that number. And that is how it can calculate dentin. So if we look at the layering, a beautiful layering that Shirin has done over here, just an example. So this is a way where we can use the recipe. So with the filters, we can use the recipe. With the filters, we can look and make sure we can see the difference, the delta difference that I was talking about in the beginning. We can always use eLAB without the filters because they're about 600 euros, which is in a way, think about a shade that doesn't match and the patient has to come back twice, there's your $600, or even once, there's your $600. So in a way, it's good to invest in it. It's not that much of a big deal to avoid multiple appointments. So we can still do it with just a gray card, but then there's more room for error doing it just with a gray card because we can't calculate the delta. We can only see with our eye, and the software and the computer with our eye, does it match or does it not match? So it's not a scientific way of looking at it. So a little example. So the software has suggested we use an M00 ingot for the substructure. So we have, this is what we use. This is a real case that Shirin had layered. So she used a dentine of the recipe given by the eLAB software. And now everything starts changing. So this just shows you that it doesn't necessarily mean that, you have the software, it will give you the full recipe, especially not for a single central. It will give you an idea. It will, lead you to the right way. But in the end, it's talent, knowledge, experience, and all of the above that will give for the perfect results. Because there's more to it. Now, all of these, there's no recipes. The recipe will not tell you how to cut back, where to put your effects, what powders to mix to get the effects. It will only give you your dentine color and your enamel. But a tooth is not dentin and enamel. A natural tooth is all of these things here. It's mamelon colors. It's opalescent colors. It's, creating halos. There's there's a lot of work into layering teeth, and this is why it's disappearing. Everybody's gone now for full contour, which is great. We do a lot of full contour. It definitely has its place, but when we're talking about a single central or a highly aesthetic case, this is the way to go if we want to have natural looking results. So once that layering is done, we can take a picture now on our end of that final crown, or as much as we think that it's finished. We take a picture of it with and without the gray card, with and without the filter, and we can transfer that into the software, and there is where our digital trine begins. So here you see the tooth has been cut off in the software and copy pasted into the actual picture taken at the clinic. And since both pictures have been calibrated with a gray card, we are sure that the colors are correct. Now look at the difference here. We started doing this about a year ago. We noticed that this is the plaster model, and you could only crop it as a square. Now you can actually crop the whole tooth as the software has evolved. But we used to put a little more, put some wax, because this is exactly the same tooth. But again, this shows you how external factors influence color. Here it looks lighter in color than here. Here it matches much more than it does over here. And all of this is due to the fact that there's no pink here and there's pink here. So this is just a great example of how the external factors influence. So it's the same tooth, nothing has been changed. So over here we can see that, we looked at it with our critical eye and also with the delta. The delta was able to tell us with the A and the B values what we needed. So here the color was acceptable, but we needed to warm it up a little bit more on the incisal edge. And again, here it was again acceptable doing that, but it needed a little more warming up on the gingival. So by doing that, now we can see the tooth, you know, we can make and see the effects that are there, the halo, the opalescence, you know, surface texture. Again, this was a tooth, a very young patient where the tooth was very, very textured. Makes a big difference. I mean, you can get the right color. If the tooth is flat, it will never match, even if the color is correct. So it's really the combination of all of these that makes a big difference. And then we can also do it a different way, which Shirin has, you know, been smart enough to figure this out and do it this way, is she takes the tooth and she cuts it in half, right? So the restoration is taken, mirrored, and cut in half and placed on top of the natural tooth. So I don't know, it doesn't look much because the color is pretty damn good. That's why we can't see it that much. But over here, there is a slight difference in color. And this here, this part where you see the square is the, you know, the crown taken on the model. It was mirrored and placed on top of the picture taken at the clinic. And we can see a slight difference in color. So we know what to correct here, see? And over here, it has been corrected. So here it's perfect. It matches perfectly. You don't even see the transition between the two. So we know that, you know, the shade is going to be correct in the mouth. The use of the filter really is what allows us to go and look at the actual LAB values. So the value, the luminosity being the L, the A being between green and red, and the B being between yellow and blue. And this really helps us because, you know, when we take a shade with a filter on, this is what really does determine and give us that difference in the delta. Over here, we can see CIE 00 delta E. This is what we look at for that value. So the difference between the natural tooth and the restoration, here we have a delta difference of 0.68, which is amazing. And here we have a 0.45, which is even better. So that difference is amazing because if you remember, at 1, a human eye cannot perceive it. So we're under 1. And in many cases, Shirin has even gotten 0, which is crazy. But that's, you know, for single central, that's really what you do want. Real case, there is the case that Shirin did at Styledent, and beautiful, beautiful results. I mean, really could not ask for better. Very difficult tooth. Now, let's face it, it's not all flowers and candy. This tooth at the lab, to get it to this, we had a lot of work to do, a lot of picture taking, a lot of corrections with eLAB telling us that we were on or off. So it's not as simple as 1, 2, 3. There's still a lot of work that is you know, required at the lab. But the beauty of it is like having the patient there, we can do a digital try-on. Another case, if we look at over here, again, 2 pictures, one with a filter, one without the filter. You see how there's reflections here because there's no filter, and over here there's a filter. We even see all of the internal structure much better, much clearer, and there are no reflections. So what it does here is we want to measure the dentin. We have the LAB values over here. The beauty of eLAB now is it actually gives and takes into consideration thickness, and it even takes into consideration prep shade. So here we tell it that we have an ND2 prep shade from the Natural Dye Material Shade Guide. If not, it's the same as the ST. So you have the ST 1 to, I think, 9, and then ND 1 to 9. There is an equivalence between the two also that can be done. Both are good. It tells us our dentin, so we need to use basically 2 measures of dentin A1. The enamel we should use is TI1. But again, this is what it gives us with an ingot 0 M00. The reality though is for this case, if we were to do it this way, it would not match. All it gave us is the right value of the color. The rest is, again, talent, experience, know-how. Because this is what it took to make this restoration. So Shirin used the porcelain we use on zirconia is Willy Geller's creation. We've been using it for many years, beautiful porcelain. Not necessarily easy to use, but once mastered, beautiful results. So the recipe just is used over here and over here. And then from there on, cutbacks, effects, etc., mixes, are just in Sherin's brain, or whoever ceramist who's doing the case brain says that, okay, this powder gives me this color because of experience, so I can use that opalescent for this effect, or that mamelon color for that effect, etc. It just continues on and on. So it's not, I mean, there's at least 11, 12 powders in this tooth. It's not just dentina or enamel. We do our first check. So first bake, let's see, are we close? Are we not close? We have a difference of 1.43, which is not bad for a first bake, but we can do better, definitely. So now we go ahead and we make certain changes from those values, understanding the A and the B, understanding the reddish, understanding the yellow. And we go ahead and look at the results after the second bake, and just by putting a little bit of glazing liquid on it, we can see that there's a little bit of pink missing. We can see the numbers here. We can see that the A here, B being the restoration, A being the natural tooth. So our restoration, the A is lower than the A on the natural tooth. So that tells us what is needed. It tells us where we're at. It gives us our difference. We're at 1.55. So this is very acceptable. But again, can we do better? Yes, we can do better. So we make our little, corrections. At this point, they're not major. We can just do them at the glazing stage. We evaluate at this point. Once it's done, we take exactly the same picture. So there's a lot of picture taking at the lab, a lot of setting up, a lot of time to get results like this. And now we are perfect because we're at 0.43. So 0.43, I mean, is very negligible. It's perfection. So I mean, that's the case in the mouth. That's an implant supported crown, I believe. So good job, Sherin. And just another thing I want to mention is eLAB is not necessarily just for just singles. I mean, we use it a lot for two centrals, not necessarily just single restorations. Or we use for even certain groups if we want to make sure, like a group of 4, a group of 6 less. It's mostly a group of 4, a group of 2, or a single unit restoration. And say, for example, here we wanted to match the lower teeth. This was the color that the patient wanted. So a lot of effects, a lot of natural opalescence. So we take the picture, same plan as you see. I mean, the lateral is twisted, so we have to twist the same way to take that picture. And again, the evaluation, we have our basic recipe that is given to us. We start with a recipe for the dentine, and then for the rest, it's experience. We go ahead and take pictures, and we see that the luminosity, there is a little bit of a problem. It will tell us here. If it is, we can have certain corrections. And this is just a try-in, the digital try-in. We can see if we're matching. Important factor, surface texture. So the best way to do it really is on a model and on an analog model. So here we see the natural laterals, the surface texture, and we have matched, Sherin has matched the surface texture of the 2 centrals exactly to the one of the laterals. And that really plays a big part in perception. In many, many situations, or, in the past, while learning also, and while, seeing how many people work and different people work, there's the standard of, an unfortunate standard, I will call it, of surface texture, where all surface texture is always the same. I mean, it's just, okay, we'll make a crown, we'll make a dip here, a dip there, and a couple of lines here, and there's our crown, and every crown looks the same. You cannot do that for aesthetic cases. I mean, it's not. Every mouth is different. The adjacent teeth are different. And if it matches or not, that is one thing that really does make a big difference. And there is the final case in the mouth, which looks very, very natural. And it's not due just to color. It's due to the combination of things: effect, color, surface texture. Important part here is prep shade, with filter, without filter. And again, with filter, without filter, we can see the result. Prep shade is so important that we actually replicate it and duplicate it on single centrals or on veneers. So at the lab here, this is a case where the prep shade was very dark. We needed to mask it. We used opaque white zirconia to do that. And so now we can start from a neutral base. you know, we do our recipe over here. Again, from what eLAB says, and then the effects and enamels and cutbacks and all that. It's Sherin's genius that does this. And we can evaluate with a digital try-in. Digital try-in without the filter, and final result. And this was not an easy tooth. So, and even if we look at it in a black and white picture, allows us to look at the value. So if there's a difference in value, we're gonna see it in a black and white picture, and it's perfect. So this is, as I was saying, not only used for singles, but used for groups. And I mean, when used for groups though, what you need to be careful is this picture is okay, but it doesn't really tell us anything because we're not trying to match the temps. We're trying to match the natural tooth. So that's the canine. So this is why this picture is necessary. So turn the gray card this way, turn it towards the same plan as the canine as much as possible like this, and take that picture. So with filter, without the filter, and even use the lower teeth. This was it. This was the group of 4 anteriors. It was done. Colors nice, acceptable, more than acceptable, I would say. Very nice job. Things now to look at and avoid. So these top pictures are great. The plan is correct, a nice overall plan. We're going to do the 2 laterals. This is a nice color also for the prep shade. So we have the prep shade for here. But when it comes to the actual tooth color, well, this picture is not necessarily correct because the teeth are angulated. So we want to turn that gray card in the same way as the teeth are turned that we want to copy, and they are exactly on the same plane. So this is no good because you see this circle here. This is basically where we need to focus our camera in the middle, and this is what the software takes to calibrate. So this must be unobstructed, so clean. You know, you don't want to have any spots or any water spots or disinfected spots or anything, any dirt or anything on that. You want to have it clean and unobstructed by light and the flash. So this is no good because the flash is all over the gray card, so the software will never be able to calibrate it. So it's a useless picture. This is a good picture because there's absolutely nothing going on here with obstructing the view. Again, same thing without the with the filters, so without any reflections. And we can go ahead. This is a case that was done where you see these 2 are stumps that we replicated. So this was a veneer case, and we went a little too far, I think, for this case, but it is, you know, you need to do what you need to do. My team actually milled ingots out of zirconia. Here you see them. And they stained the ingots. Sherin stained the ingots to replicate the exact shade. Now, exact shade. We're not talking about composite ND material from Ivoclar that we have that kit too, but this is the actual stump shade because it will mimic the translucency as well. So this is just for the stump. This was put on the model, and then the veneer was made by sitting it onto the exact stump shade. So now when we're taking pictures, we're taking them on the actual stump shade, which influences in the mouth, obviously, the final result. Again, another example of another single central that we were able to make. This is a very challenging case on the incisal third. You can see here how challenging it is. The patient was had a temporary for over a year, and he decided to go back once that temporary became very, very yellow, as you saw in the previous picture. So this is why he has gum trauma. So this was at insertion. I think that must have healed. But if we look at the aesthetics of the case, I mean, Sherin could not have made a more perfect tooth. She actually wrote an article that I believe will be published at some point. We don't know the date yet, but she wrote an article, I think, in the Quintessence Publishing, and she is showcasing this this case. It's just so beautiful. I mean, it just looks like a natural tooth next to it. A couple of tricks, shade taking, as we said, if you don't have the filters, again, we can do it, but it's not guaranteed 100%. I mean, again, nothing is guaranteed 100%, but with eLAB, with the shade taking protocol, the full workflow, with the you know, with the polarized filters, if the picture is taken in the correct angulation, we are very close to 100%. I mean, we've been doing it for 2 years with great results. We're at like 98, 99%. Without, it diminishes to about 80%. But still, I mean, a great way to do it, especially for people who are, you know, who are far and distance is an issue. And especially with what we're living in today, if you don't want to invest in the full thing and you don't mind seeing the patient possibly an extra time, then it's possible to just invest in a gray card. It's about 60 euros. It's something that needs to be changed periodically because by disinfecting it and cleaning it, the color can come off. You cannot put this in a Cavitron. You need to you know, just disinfect it with Cavicid or alcohol and with wipes. So that you don't damage it and you keep it longer lasting. But what needs to be, what we need if you choose not to go ahead and use the full protocol is, all we need is the picture of a shade tab, a very close shade tab. So what your eye says is the closest color with the numbers, you know, included in that picture. We want to be able to see the number. Again, the shade tab must be in the same exact plane as the tooth that we want to copy, and the same thing with a gray card. And of course, you don't have filters, so we don't need to take a picture with the filters. And this is how it allows us to look and evaluate at the lab. We make the restorations and we place them in the software. And now with our eye, we don't have deltas, we don't have recipes. It's just by eye. We can see if it matches or it doesn't match. Still a great tool. I mean, still light years ahead of where we were even like 3 years ago. This came out about 2.5 years ago, and we've been doing it for 2 years. So this is a great tool. Another case, single central. This was done without the polarized filters because we had started without the polarized filters. We just started with a gray card and the software. And I mean, very challenging tooth. And again, Shirin made a miracle and just made it work. So another single central. We do a lot of single centrals. Another case here, central lateral. And this was a nice case too. This was lateral central that was also done. So all these were done without the polarized filters, and yet we were able to have very decent results. I forgot to translate this one. Nouvelle approche. Oh, excuse me for that. So these are just examples of how we can check for the shades. Whether it's laterals, whether it's centrals, whether it's like groups, basically anything in the anterior region. I mean, we've done a couple of eLABs for some clients that are very demanding on the posterior, but it's very rare. I mean, it's really not the norm. The norm is mostly for anterior teeth. This was a beautiful case, challenging case. So the lower fours. So this was very nice to use eLAB because you can see how many effects are in these teeth. So to get something natural, we were able to do a digital try-in and replicate those fissures and those crack lines, etc., that were needed. And just more cases, single centrals, all sorts of colors from bleach to very low value colors. Important part here, things to avoid. So this here is taken while the tooth has been dehydrated. So first mistake, very dehydrated. We can see the whitish, you know, opaquish result here because I mean, this is the same tooth and now it's hydrated and we can see that there are some effects here that are completely not visible here. And also this was taken in the same plane as the central we want to replace. So there's no point in doing that. So what you want to do is you want to put that gray card in the exact same plane of the tooth that you want to be copied. So important part is it's not of the restoration, where the restoration is going to be, but it's of the tooth that we want to copy. And here, again, this is a correct picture because it was angulated properly and it was angulated towards the tooth that we want to copy, not the restoration, where the restoration to be made. Again, other mistakes here, things to avoid. Overexposures, we can see flashes, we can see dehydration over here again. Important to make sure dehydration doesn't happen. We see much more effects over here than over here. Again, this is not taken without a filter. This is not taken, I mean, with a filter. They're both taken without filters, and yet just the angulation makes a big difference in how the picture is and also the dehydration of the teeth. Again, here we do not want to take this picture again overexposed and not correct angulation. And here, my God, you can see the reflection on the card itself. So that will never calibrate in the software. So that is not something that we want to do. Another thing to make sure is when you have a patient that has very translucent incisal edges, or a young patient, doesn't matter in that fact, you want to have them go to bout à bout. You want to have them open slightly, like on the first picture, so that we can actually visualize the internal effects and the incisal edge. Because if they're completely closed and centric, we don't see much. So you want to ask them to open a little bit or go bout à bout so that we can see the what's going on in the inside. Another thing is when using the retractors here, the mistake here is that the mouth is behind and the cheeks are creating a shade over the teeth. So that is false. What you want to do is ask the patient to really pull towards the back and not create a shade with their lips and with their cheeks, basically. And again, here they're closed and centric. Here they're a little bit of bout à bout, which allows us to see the incisal edges. So that is a great way of going about it. And that is the end. That is how the presentation ends, and that's the end. And I really hope that you enjoyed it. It's a great tool, honestly, guys. We've been using it for 2 years. It's great. It's really a great result. So thank you so much for following us on this beautiful day. And I will now open up to questions. Any questions?
I don't see any questions in the chat so far, but please don't be shy. Anything that might come up?
So if you don't have any questions, I just want to remind you guys that once you follow, go ahead and you know, it's very easy to fill out our little survey that we send after each of our courses. We always send a survey. Once you send that out to us, we will be able to in turn share this presentation with you guys also, so that you can have all that at hand and remember the parts to you know, the important parts and the parameters, and just to have examples of how to place the card, etc. And of course, we're there if there's any questions or you want any more information. We're always there to answer you. You can contact us by email, info@styledent.com, and we will be more than happy to answer you. Shireen too is available for any questions that you may have. She really is the one that brought this system in the lab and has a lot of experience with it. She's the one who taught us how it works and continues to teach us. So that's great. It's just a beautiful tool. It really is. And very, very, I guess, you know, very relevant nowadays with COVID. So, you know, that's why we thought it would be a great way to present it. We presented it in French. Today we presented it in English. And next week actually is going to be our last conference, because we gave a lot of webinars during this whole crisis. We were giving about 2 to 3 a week. Thank you for those returning to this one. We really appreciate your support. And next week we have a new content, which will be the last one. It will be in French. Shireen is going to give it, and it's going to be on full arch on implants. So very interesting one. Just you know, stay tuned for the exact date, but it will be it's a subject that we have often had questions about, that has been in demand. This is what the surveys also help us do, is create more and more content and relevant content. So so if you guys are interested in that, it's going to be given in French by Shireen and probably in English at a later date. So any questions in the meantime?
Nothing in the chat, only great comments and thank yous from everyone. So we thank you for being
we thank you. Yeah. So stay safe. You know, we're all happy to be opening, but the most important thing, let's all stay safe, and let's all support each other. And I mean, it's passing. Let's hope that it will pass sooner than later. But there's always a silver lining at the end of the, there's always a silver lining and a light at the end of the tunnel. So let's all stay positive.
Yeah.
Thank you very much.
Thank you. Have a great day, everyone.
Bye-bye.